Good afternoon, Dr. Bregman. How are you doing?
Great, Linda. Good to see you.
All right. Well, it's all about the kids these days, and we're talking a lot about families. Certainly there's been a lot of press, and we've been getting a lot of questions from moms and dads concerning their kids as everybody's preparing to go to school, or in some cases not go to school. So this comes from a very concerned mom right here in Florida, in South Florida. And she says, Dr. Bregman, my son has pre-existing mental health conditions. We were always lucky to get treatment for him at a school. But since school will not be in session this fall, can I just wait to get him therapy when school starts again? Thanks, from Brenda, and she lives in Margate, Florida.
This is a really important topic. And really, the simple answer is, Mom, Brenda, you need to get your kid some help right now. Your child with a pre-existing illness is at great risk, very vulnerable. And they can develop all kinds of medical problems in terms of changing the brain size and neurochemical problems. So these are children that are absolutely are the most vulnerable. And I think waiting is certainly a bad idea at this point.
Okay, let me ask you something. For parents that are having kids that are suffering from mental health issues, what would be some signs that they should look for from their daughter, from their son, that should be red flags and say, uh-oh, I better get Johnny or Sarah some help?
Okay, well, that's a great question. And it's not just for Brenda, because she has a certain age child. Really, what we think about is, let's take a look at the little kids, 0 to 6. Well, they regress. So any form of regression that we see in terms of sleeping patterns, toilet training, clinginess, so that's the smaller kids. As the kids get a little older, and we see this in latency kids from on to adolescence, we see a lot of anxiety, a lot of fear, a lot of concern about grandma, anxiety, depression. Kids can get very depressed. They get irritable. They stop socializing with their friends, and then behavioral discontrol, behavioral problems, belligerence. So along with anxiety that we see, a lot of panic attack things, generalized anxiety, and depression, we really have to look at behavioral discontrol. So if your kid's really acting out, that's a real sign for a teenager.
Yeah, and I was reading most recently that COVID obviously isn't just pushing the envelope with pre-existing conditions, but kids that were fine before the virus are suddenly, we're seeing some kids, like you said, act out or regress. So this seems to be almost not maybe a pandemic, but an epidemic that has evolved out of the pandemic.
There's no doubt about it. There's so much that's said about the physical part of what's going on with COVID, but what about the mental health repercussions? The kids are greatly affected. I mean, parents have financial problems that greatly affects kids. Their whole sense of security their world is really turned upside down at this point. And even healthy kids, we need to look for signs that they're not doing well either. But the pre-existing illness children are the most vulnerable. And it's unfortunate. Do you know that over 50% of the mental health that kids get happen at school, and now they haven't been going to school? So all those kids have lost all their mental health resources.
Okay, so what do they do?
Well, luckily now we do have a lot of services online. And I think that parents should avail themselves to get online, and they can Google and so forth and find resources for their kids. So that would be my number one suggestion.
All right. Well, great suggestion. And we need to pay attention to our children right now, pay close attention, as this is, not only a hard time for all of us, but especially the kids. So
Right. And
heads up.
yeah, and I think it well said, and we shouldn't forget them with all the pain that the parents are going through, that the kids are going through a lot of pain, and it's good to listen to them and find out where they're at.
Well, thank you. Always good advice, and we'll be talking soon.
Take care. Yes. Bye-bye now.
Don't suffer alone. At BregmanMD, we can help with our years of online therapy experience. Just give us a call or contact us online.